Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, the NCDC is still cautious on the use of chloroquine and hydroxychloroquine for the management of COVID-19. Normalcy returns in Nasarawa state after ease in lockdown restrictions. And European Union canvasses reopening of all borders by the end of June. The Nigeria Center for Disease Control, NCDC, has updated its case management guideline based on the advice of the World Health Organization, who constantly analyzes new research to provide guidance for a healthier and safer world. The NCDC has now adjusted the following to enhance the management of cases of COVID-19 in the country, to include the use of antivirals or any other therapeutic medication such as chloroquine and hydroxychloroquine is not recommended except when used as part of approved clinical trials. Symptomatic patients may be discharged 10 days after symptom onset, plus at least 3 days without symptoms, fever, respiratory symptoms. The new COVID-19 case management guideline also allows asymptomatic patients to be discharged 14 days after the initial positive results. That's the date of collection of sample. Total confirmed cases of COVID-19 in Nigeria has risen to 11,516 after the Nigeria Center for Disease Control announced 350 new infections in 19 states and the Federal Capital Territory yesterday. The NCDC also announced the discharge of 3,535 patients and the death toll at 323. Of the 350 new cases that were recorded in Lagos, with 102 of the cases, Ogun 34, the FCT 29, Borno 26, Kaduna State 23, Rivers 21, Ebonyi 17, Kwara 16, Katsina 14, 10 each in Edo, Delta, Kano and Bauchi, Bayelsa 9 cases, Imo 8, Plateau 4, Ondo 3, Nasarawa 2, 1 each in Gombe and Oyo states. A look at the breakdown by region shows Lagos in the southwest still with the highest number of cases at 5,542, followed by Kano in the northwest with 980 cases. The FCT in the north central region maintains the third highest tally in the country with 729 cases. Borno maintains the highest tally in the northeast with 322. Edo leads in the south-south with 351. Ebonyi leads in the southeast with 80 cases. So let's get back to analyzing the guidelines from the NCDC with regards to case management of COVID-19. And Dr. Babatunde Ikpaye is a public health specialist and former consultant health specialist with the World Bank, and he joins us now from Abuja. Thank you so much for joining us on the program. Let's begin by asking your take on the new advice from the World Health Organization on managing COVID-19.
Thank you for having me. Good afternoon, Nigerians. Like I've said on this platform on several occasions, COVID-19 is an emerging public health concern, and then public health knowledge will continue to grow. And of course, as evidence emerge, and it will guide, of course, decisions to be taken around the prevention to treatment continuum. So it is good that some of the researches that have been done in some places, including Nigeria, have actually shown that after about 10 days of confirmation of infection, many of the positive cases are just from the viral particles that are still there, but that are not able to grow or cause any further infection. And this body of evidence, from the recent research done somewhere in Singapore and some other places, have actually guided WHO to say, okay, instead of relying on the PCR testing, which will waste resources to define those that will be discharged, once many of the viral particles picked, particularly after 10 days, are not infective and would not constitute any public health danger. So why don't you allow most of the patient to go, anytime after then? And so the guideline says, for those in treatment, if you are able to, wait after 10 days and they don't have any evidence of fever or any other symptoms for 3 consecutive days after 10 days, and then you do the peripheral oxygen of more than 95%, then you can discharge without, having to rely on a negative result. And of course, for any asymptomatic patient, after 14 days, they usually become ineffective. So, and it's a good news, and it will also help us as in Nigeria or as a country to use resources more efficiently.
But Dr. Ekpare, don't you think it will also spark some fears, some anxiety over knowing that your test has come out negative and you're saying that this is not perhaps one of the reasons why you should be discharged? Because on the discharge criteria, it says a negative laboratory test is no longer required to discharge a COVID-19 patient.
Now, like I said, this is based on evidence. The reason why we traditionally insist on a negative test is to be sure that anybody you discharge is not able to, become a public health, embarrassment or danger to the public. But you see, if repeatedly studies have shown that after 10 days, even when you pick a positive test, those positive are just indicative of the RNA, of the nucleic acid that are left over, or the viral particle that are there that are dead. And then several culture that has been taken after between 10 to 13 days have shown consistently no viral growth. So with this kind of evidence, you do not actually need because you know that for Nigeria we need to do many more tests, and then if you need 2 more tests, you actually deny some other people who actually need to be tested in the first place resources that is required to test them. I'll give you an example. For some other conditions, for instance, malaria. Once you test for malaria and it is positive, once you treat, you don't go back to test again once the person gets better. So I think what we need to do is to reinforce this evidence and make sure that Nigerians have a good understanding of why that decision is taken. And of course, we need to discuss it over and over again to bring public confidence into this body of evidence.
But seeing as well that it's coming, from the World Health Body, would you say that we are perhaps over-reliant on the international community to finding solutions to, what has been termed the novelty of the coronavirus?
Well, the solution has to be looked for everywhere. You need to know that many of the investigations and the research that are going on are also going on in Nigeria. So the mere fact that we don't come to Nigeria to say we have collected samples in Lagos or in Kano is also to hide the identity of the location and the people that may have been involved in the research. And it is part of the ethics of public health research to actually have some degree of confidentiality when it comes to those who have contributed to the body of evidence. So yes, the coronavirus condition and research is not novel to Nigeria. It's actually a novel public health to everybody globally, including WHO. And then, but as we begin to understand the epidemiology better, so decision-making processes is improved upon, and of course, resources are better utilized. Because what we need to do is that when we look at resources that are available within the control space, you need to balance, they need to reach many more people, and of course, and they need to actually be unnecessarily detailed. So efficiency and effectiveness has to be brought into deployment of resources, because resources would never be enough anyway.
All right, seeing as the world is celebrating Environmental Day today, it's estimated that globally about 1 billion cases of illness and millions of deaths occur every year from diseases caused by coronaviruses, and about 75% of all emerging infectious disease in humans are zoonotic. I mean, transmitted, to people by animals. And we've been told that nature is sending us a message. What do you think we can learn from a day like today, World Environment Day?
What we need to learn is that we need to be cautious. We need to know that as the world continues to be reduced into a smaller global village in terms of interaction between man and man, and of course the interaction between man and animal, and of course between man and other species, we need to begin to take serious caution. And the lesson from COVID is that the world will emerge with what we now call the new normal. And, in time past, the way we greet people and the elderly before now is that many people will have been scolded if you had greeted, if you greet any elders or any elder the way we do now. But, a whole lot of things have changed. And of course, the lessons from Corona should go beyond this epidemic period. And then we also need to begin to take seriously and significantly environmental hygiene, environmental management, and of course, issue around the personal hygiene. Because, of course, if you look at the history of public health, environmental health has contributed the most in terms of, achieving significant disease control globally, either from the period of smallpox to cholera to typhoid to now, to SARS and, of course, to COVID-19. It continues to, come to us that environment is very critical, and that whatever you throw into the environment will throw back at you.
All right. We'd like to appreciate your time, Dr. Babatunde Paye, public health specialist, former consultant health specialist with the World Bank. Thank you for joining us. And over in Nasarawa State, normalcy appears to have returned following the lifting of lockdown restrictions in the state. Our correspondent Halima Gayam brings us this update.
Nasarawa State stakeholders have met to review COVID-19 containment restrictions in the state. In the preamble, Governor Abdullahi Sule gives details of the status of the state.
We have a total of 705 people who have been tested in Nasarawa State. Out of this number, we now have 90 cases. So we are among the top 20 now in the Federation. Out of the 705 samples that we have taken, 658 have been received, and we are still awaiting the rest. And unfortunately, we also have 4 deaths.
After deliberations, the State Health Commissioner discloses measures to lessen COVID-19 testing time in the state.
We're also expecting from the NCDC very soon a testing center within the state. From the Nigerian Governors Forum, we're also expecting a mobile testing lab.
The ban on motorcycles have been lifted. The markets have been opened too, with emphasis on the strict compliance on safety protocols. The police boss speaks on the enforcement of interstate lockdown, which is still in place.
We will arrest members of the public that will not work within the purview of the proclamations, regulations, and the law of the land. Particularly, the ban on interstate movement. We are going to enforce that with more aggression.
Residents have been strongly advised to cooperate with authorities to flatten the curve of the coronavirus in the state. Halima Gayam for COVID-19 update.
So to come on the program, we have more on the global response to COVID-19. Join us again. Welcome back to the program. And a public health physician joins us here in Lagos, Dr. Amina Ahmed. Glad to have you on the program.
Yeah, thank you very much. Thanks for having me.
All right, first I'd like to get your thoughts on the new guidelines from the NCDC with managing COVID-19 cases and more on the stopping of some antiretroviral drugs which were formerly used to manage COVID-19 patients, and that includes hydroxychloroquine and chloroquine. Well, it says except for clinical trials. How do you think this affects, ability to really manage the virus?
COVID-19, yeah. Well, thank you. Medicine is actually dynamic. It's we work with evidence. Whatever we want to do, we would actually have to have tested, checked before we know what to do with it. We'll have to. That's why many times we change, we move forward. There are usually processes on treatments, treatment protocols, management protocols, and all of that. So once a new evidence comes out, you would see that you notice that something will be changed. A few weeks ago, there was the NAFDAC said that we could use hydroxychloroquine and all of that, and then just another week again, they're not saying except if it's for clinical trials, we should not use that. Of course, there must have been. This is following some statistics, some evidence that must have been carried out, and that's why the NCDC is saying that we should tarry a bit and see. Use it for clinical trials first and see what the outcome would be, and then we'll now see if it could be used on patients again.
But how does this affect explaining it to the patients? Who wants to get well at all costs, and who's saying, you're changing this treatment today, you're saying this works tomorrow, at that level? Well,
the patients would, of course, understanding this now to the layman, making it easy for the layman to understand is a bit difficult. But then it's something that we would really have to look at a way of telling them that, okay, this is what we're looking at now, especially that COVID-19 in itself doesn't have a cure. All that we're doing are supportive management, actually. So it's not as if there's a particular medicine that is being used to treat COVID-19 as it were now, where we have over 1,000 drugs that are still under trials to be sure that, okay, this is what we can use to either reduce the severity or to treat to reduce the viral load in the patient. So since we do not have exact figures, exact reactions as to what drugs to use per se now, then we'll still have to tread with caution, especially when we're treating patients that have COVID-19. So it's still it's a progress. It's time that we're in, and we'll have to watch out and see how we're going to treat patients.
All right, we'll come back to you. Just being told that Chiponda Chimbelu, Deutsche Welle correspondent in Berlin, is joining us right now via Skype. Chiponda, if you can hear me, would like to thank you. Good to see you. First, we understand that the EU Commissioner for Home Affairs is saying states should reopen internal borders by the end of June. How does Europe's largest economy feel about it?
Well, of course, Germany has also been in discussions to get borders opened. Obviously, they want to get the economy going at this point. Tourism is a big sector in several countries, especially, for instance, neighboring Austria, which I think gets around 15% of its GDP from tourism. So that discussion has been ongoing, I think, for the last 2 weeks or so. And definitely they want to move things forward as fast as they can with with a certain amount of cautiousness, because obviously they want to prevent the COVID-19 pandemic from, spreading. But obviously things are looking much better now in Europe.
Also, hoping that it plans to drag itself out of the potential recession due to the coronavirus. What about the 13 billion euro stimulus package? What's the response been?
It is actually 10 times, way more than that. It's actually 130 billion euros we're talking about. So it is the most significant amount of money when it comes to, pumping money into the economy within the Eurozone. It is the biggest, or it's historic. It's the biggest in Germany since the Second World War. So it's a major deal. And obviously that is something that Germany hopes will help stabilize the economy. It includes, cutting the sales tax and a few other measures, obviously.
And quickly, Chiponda, it was reported sometime a while ago that the Afro-German business community was the hardest hit due to the lockdown on COVID-19. What's the atmosphere, now following the reopening of activities?
Well, the Afro-German community wouldn't be that different from any small business community here in Germany. In fact, small businesses obviously suffer more from the effects of COVID-19 because obviously they have less profits, they are less organized, and obviously they don't always have, like, say, a tax accountant. So I think it's not that different from any other businesses, but obviously things are picking up slowly, and there's a good chance that maybe they will be able to get all the help they can. Part of the problem had been with, processing applications for them initially, but that could change in the coming weeks.
All right, Chiponda Chimbalo, thank you again. Deutsche Welle correspondent joining us there from Berlin. Let's come back to you, Dr. Ahmed, and that is, Nigeria is also trying to reopen, trying to get back our lives to normal, which is, interesting, different in many regards. But Lagos yesterday gave out more modalities to reopening. Some people are scared. Some people are saying we just have to go with it. What's your professional point of view?
Oh, well, the truth about it is that we've had this pandemic for some time now, upwards of 5 to 6 months now in the whole world, and then Nigeria from February till date. And people are getting a bit uptight about staying back at home, which is, of course, expected because they're human and all of that. They're very highly transitory people. They move around a lot. So but what we're looking at is, the thing is, the world has to move on. Life has to continue. A lot of things have to be put on a balance, health, economics, and other things. So you would have to look at how we're going to use strategies, health strategies, to actually curb this disease while still trying to see that, okay, the other aspects of life continue. And that's why reopening of the economy in phases will have to start. Of course, raising restrictions from mosques and churches, like the governor said yesterday, but 40% capacity and all of that, it's a step in the right direction. I wish we could do something, maybe probably less than the 40% that the government is suggesting because of the crowd, and then because this is droplet infection, and then when droplets come into the air, they're suspended in the air, and the length of time one is exposed to it is what really affects. Makes it easy for the droplets to infect the person. So we would still have to look at this with other strategies, using face masks, social, physical distancing, and then, of course, reducing having to, we should not hug or kiss each other and all of that. So when we put this together, perhaps it would help us a bit and try to curb the disease and bring the numbers down, at least from what we're seeing.
All right, there's a lot of hope there. We'd like to thank you, Dr. Amina Ahmed, public health physician. Thank you for joining us on the program.
Thank you very much, and thanks for having me.
And just like we heard from Chiponda, so the summer tourist season approaches and countries across Europe are keen to reopen their borders. But while some states are working together, it has not yet been organized across the EU. All EU states on Friday are to agree on a date for the end of June. Well, Italy opened its borders on Wednesday, same with Austria, who lifted its border restrictions on all its neighbors except Italy. In the meantime, over 6.6 million cases have now been recorded worldwide. Sadly, more than 391,000 have died, but about 2.8 million people have recovered.
Residents in Madrid are eager to reach next stage of COVID-19 lockdown, even as countries across Europe are keen to reopen their borders in time for the summer tourist season. However, while some states are working together, it has not yet been organized across the EU. European Home Affairs Commissioner says she wants all EU states to agree a date for the end of June. Hundreds of people flocked to a mosque in the Indonesian capital after the governor eased coronavirus restrictions, including opening places of worship for the first time since mid-March. People are supposed to stay at a meter apart and have their body temperatures checked before entering. In China, the number of new confirmed COVID-19 cases in central Hubei province, which is the province hardest hit by the epidemic, had dropped to 0 on Thursday. The Hubei Provincial Health Commission says the last 3 confirmed patients had been discharged from hospital after recovery. This is the first time the province reported zero existing confirmed case since the outbreak of the epidemic.
And from the NCDC, every new case is motivation to keep pushing. Each recovery is proof that we can get through this together. Take responsibility in protecting your health. The NCDC website is sending that message. Its website has all the information and statistics, regular updates on the COVID-19 regulations and guidelines. It's the same from the World Health Organization. You'll find the coronavirus disease situation. Also, the dashboard is an interactive map. It provides the latest global numbers and, of course, the plans on the coronavirus. Each day, it keeps updating. Our website, channelstv.com, has the latest news. All you need to do is log on, access news in all the sectors from Nigeria and around the world. That's channelstv.com. And that's a COVID-19 update. Thank you for watching. I'm Millicent Nwaka. Stay healthy, stay safe. I'm back again at 6.